السلام عليكم ورحمة الله تعالى وبركاته. بسم الله الرحمن الرحيم. We are more than honored to having with us Mr. Amr Metwally, who will be presenting this amazing webinar, and I'm more than proud to having also my dear friend Siham Baghdadi will be responsible for chairing this session. My name is Mohammed Mohawi. I'm the head of Morocco team. We stand for the Moroccan Society of Simulation for Healthcare. So welcome everyone, and without further ado, I will give the floor to Siham Baghdadi. She will be the chairwoman of this session. Siham, the floor is yours.
Thank you so much, dear professor. Good evening, everyone. It is a great pleasure to welcome you to this Shine webinar organized by Morocco SIM. My name is Siham Baghdadi, Vice Treasurer of Morocco SIM, and I will be your chairwoman for today's session. Thank you all for being here. Sure, your presence reflects a shared commitment to advancing healthcare education and innovation. Today's topic is particularly thought-provoking, rethinking simulation from training rooms to strategic innovation assets. This title invites us to shift our perspective, to move beyond seeing simulation as a simple educational tool, and instead consider it as a powerful driver of transformation within healthcare systems. So simulation is no longer just about learning clinical skills. It is about improving patient safety, strengthening teamwork, enhancing decision-making, and ultimately shaping the future of healthcare. We are honored to have with us today Professor Amr Metwally from Qatar, who will guide us through this important reflection. Before giving him the floor, let me briefly introduce our speaker. So, Professor Amr Metwally is a global leader in healthcare simulation and innovation with over 20 years of experience transforming simulation centers into strategic high-impact ecosystem. He currently serves in the executive leadership of Itqan, Clinical Simulation and Innovation Center, one of the largest of its kind worldwide, driving advancements in simulation-based education, digital health, and innovation. Recognized twice as the Chief Innovation Officer of the Year 2024 and 2025, Professor Amr is known for pioneering sustainable simulation models that integrate education, technology, and business to create measurable impact at national and international levels. He is also an MBA graduate from HEC Paris and a sought-after global speaker on the future of simulation and healthcare innovation. We are truly privileged to have him with us today. Professor Amr, the floor is yours.
Thank you, Dr. Siham. It's really a great pleasure to be here today. Bismillah ar-Rahman ar-Rahim. Alhamdulillah, salatu wassalamu ala Rasulillah wa ala alihi wa sahbihi wa man wala. Really, I'm really proud to be invited, inshallah. And as we see, and we say in Egypt, this is the second time I presented for Moroccan community and something organized by Morocco SIM. So as we say in Egypt, يعني الثالثة تبت إن شاء الله. So الثالثة إن شاء الله في المغرب. So I'm really glad to be here, and let's go. Basically, start immediately on the save your time. So today's presentation is basically starting, or let me start by a very simple idea. And you can actually grasp this from the title itself. Simulation never meant to be just for training function. And we will track this historically, and you will know that this is actually reality. And the way we are actually treating simulation right now, we are underutilized a big assets, a big environment, and or something that it can be really extend beyond what we see. First of all, you can hear me very well. You can see the full screen for my slides, right?
Yes, it's okay.
Perfect. Okay. So before I go in, let me make a disclosure. I have no disclosure regarding the information in this presentation. I have no conflict of interest of anything. I'm not involved in any commercial product with this mentioned in this presentation. So today, in fact, I'm not here really to give you a tool or to give you a specific strategy that you need to follow, but more, I'm here actually to challenge your mind, how you see simulation by the end. And maybe you convince with my view or my strategy, or what if I've been advocating for so long, and you agree with me that we need to rethink the role of simulation. It's not just as a center, but basically as a system assets. So let's go a little bit in the history and why simulation. And simulation, in fact, never start with healthcare. By the way, many of the processes and policies and procedures and checklists, especially in the surgical, we got it or we inherited from both either aviation or military. And the reason for that, it's ironically on the 60s, one of the American president, they thought that the army is actually over capacity, and there is a lot of older age lieutenants and higher titles. So basically, what they did, they just sent them for retirement because they wanted to decrease the age range. And suddenly, in the market, there is a huge, big number of military leaders, and those are the one that has been attracted to the industry. They needed the leadership back then, which is the healthcare. Healthcare back then, it was a big mess. And this is where they brought all what they learned in military back in the healthcare. They started to create the accreditation, the standards, and so on until they developed what we have. So simulation is not different. It has been also developed back in the aviation, back in the time. This is 1942, one of the first early simulation for aviation, how you can test this before you go into real airplane. And in fact, aviation, they took this extremely well, and they in fact developed it very well. By the way, most of the current simulation vendors we have at the moment, they are actually derived from aviation. So they have a simulation aviation business unit, and now they just started a small one in healthcare. And of course, this industry is booming at the moment. So with this in mind, if we make a very good comparison between aviation and healthcare as an example, we will see that in fact in the simulation in the aviation is a very highly maximized to the very maximum extent. Any pilot in the world, he has to undergo for 30 to 40 hours of simulator training before he renew his license. In fact, this is, and you know better than me that this is absolutely not required. It's not needed at all in healthcare. Despite, if we speak about from a risk perspective, from an error, it's actually one accident every million flights. That's why flying is one of the safest transportation. One accident every million flights. If you compare it with healthcare, this is more than 250K only in US in annual. People dying dramatically because of the medical error, because of the less training. I cannot express how many times I've presented in Africa, and people there, they lost their kids, they die themselves because very simple training. And can show you the disaster we have at the moment, how crucial is simulation in aviation despite the low risk, and how it's really underutilized in healthcare despite the big risk we live every day. So aviation, they took the simulation as a very good system capability. They pushed the system, and they didn't scale it, the safety of the simulation or the aviation as an industry through only experience, but they scale it through simulation. So use simulation as an asset. And today, like I said, there's no pilot flight without on a real aircraft without mastering a simulated one first. And the result, of course, in that is not incremental improvement, is actually a full system level safety. And this is what we are actually calling today in this presentation. And I really want you to ask yourself why healthcare is still training in real environment first. why we still conducting our training, and we prefer our training to be done in a real hospital rather than in simulation before even we go into the simulation. This is a very simple code, and this is basically which will be speak on details in after that. So simulation never meant to be a just training room. And we know that from different industry. We know it from manufacturing, we know it from automotive industry, we know it from all. It's actually only in healthcare that we consider simulation for training room. Because in other system, in other industry, it's actually a system that shaped the healthcare. It can be leveraged because it do, or it did already, or it done very well in other industries. So why the question will remain why in the healthcare we still treat it only within training room. Let's start by the problem that we are solving here, because most of the simulation center I've seen is actually seen as a cost center. Some of them, they are able to leverage this and they have some revenues, but nevertheless, it still remain as a cost center in majority of the function they do. It's a very limited to the training room, and it's a very big lacking for a strategic impact. And can say basically that many simulation center is underutilized, if not majority of simulation center underutilized. And here I have to say one thing. When I'm saying underutilized, it's not necessarily I'm saying the center is not busy with people, because this is away from the truth. Many simulation center I've gone and I've seen it, it's a full busy. But what we are talking today about underutilized, it's about the impact. So today we are actually with the simulation practice that traditionally we do, we are solving small problems in a system that is facing massive complexity, error, and mistakes. And this is big shame. Why we are doing that, and this is something we will see how we can fix with the coming slides. Because the reality is that healthcare, it's a very complex system and it's a very rapidly evolving. In fact, I can say that it's rapidly evolved before even our ability to adapt, or even patient to adapt, or even as a workforce to adapt. We have a really, and we understand that today after COVID, we thought before COVID that we are lacking around 20%, 25% with the best statistics I've seen. But we know after COVID that 50% at least is lacking for the workforce. So our growing workforce, it's really a big pressure. We have a big innovation demand, safe testing environment, and we are at the moment lacking. A lot of innovation is on board. A lot of innovation is everywhere. However, what is the impact on this on real life? When I'm asking all of you, we are knowing right now that AI in diagnostics is heavily going in a very high accuracy level. But if I'm asking all of you in your hospital how you are actually using AI in diagnostics, basically very little of you will say that we are doing that. And we have a very successful case study. And the reason for that, because we never tested. And the only way to test it in a hospital. And who has bold enough to test this in their facility or in patient directly? It's quite difficult. It's actually against the law in many countries. So the missed opportunity basically is simulation is because the simulation is the only space, in fact, we can safely test healthcare invention or innovation or training or anything. However, we only limited for training room or training activities. And this is a big shame. So why today? Why in our region? Why we think that this is very important to us and to our region? It's a growing healthcare demand. MashaAllah, population in health in Middle East and in North Africa, it's going quite dramatically. So we are in fact going also in an elderly community. Many countries they have a youth community, but we still have a growing number in the elderly and geriatric population. So growing in healthcare demand is become a fact. The workforce shortages, we know that all of our country is losing the workforce either from migrating or become an obsolete. No one wants to really go on a very long healthcare career. In fact, the money and the business and the career development might be on other area. High dependency on external training. We all know that we are counting heavily on external training, external conferences, and opportunity for regional leadership is something definitely we can manage. And I have to really commend here the Moroccan SIM activities and effort to do an Arab simulation society. And I'm sure that this is a huge step for our simulation future, inshallah, in this region. So simulation, when we look for simulation as innovation structure, we need to shift the mindset here, because we need, as an example, to use simulation to test AI before deployment. And this is, I think, it's quite strategically as important as drug discovery, because I think if there is in the future for this healthcare to be evolved, it's really utilizing AI, and even right now the agentic AI. We need to test the workflow, and this is quite important, because many of what we are speaking today is not actually tested and has been tried and tested at the workplace or in the hospital environment. Patient journey, patient experience, even that big development happen and very good things happening in our practice. The problem is that we are still far from testing this on the impact this on the real patient or real patient environment, because very simple manner, we never tested. So we tested try and error on the hospital directly on the patient. The crisis preparedness, it's quite important, because let's agree on something here. We know that if we pressure any healthcare system, it will collapse. We tested this, all of us, in the COVID, and even in the best healthcare system in the world, we started to see them how they are actually collapse very rapidly. And this is quite interesting, because when you make a system stress testing, you are not only concerned about what department will be collapsing. In fact, you want to understand which department will collapse first, so you can make your disaster management plan. Because imagine if we consider that all the departments will be collapsed equally on the same time, this is not reality. And this is not making you an effective disaster management plan. So when you know what exactly in the stress test, what exactly the department will be collapsing, or what is the best department will sustain, you can actually redesign the system so you can achieve the best outcomes out of it. So basically, this is the shift that we are looking for. We wanted to shift from a traditional practice into a very strategic, from a training room, traditional activities, to innovation platform, because I think this is what we are lacking, the innovation platform. From a call center to a decision engine. We wanted to use the simulation as a testing, a decision engine. What's meaning of that? So in fact, the data generated by the costs by the simulation center is actually used to take a decision. So when you make a decision-based, data-based decision, you know exactly from where this data is coming. It's basically coming from where you are testing. From an internal use, only limited to the hospital that you are affiliated to a being a simulation center that it can in fact serve the whole region. So you become a hub. From a reactive to a predictive. And I guess my presentation for using AI, agentic AI for adaptive simulation was giving big evidence on this. So running courses is always an activity, right? Is an equal to running activity, but change system, you need an impact. And this is the outcome, the real outcomes that we are looking for. Because the questions here we should ask is not like how many courses did we run? Because this is never should be not in any of our concern. But the right question that we need to ask is actually, what did we change with these courses? And this is something I've seen a lot of simulation center across the world. Sometimes you have a very small simulation, sometimes there's a very low visibility, sometimes there's a very low flow as well. But the outcomes that they are creating is massively affecting the whole system, if not affecting it nationally. And this is where I needed to develop a matrix, or what I'm calling SVMMM, or simulation value maturity model, because you need to understand, to make a design an impact, to strategize an action plan, you need to understand where actually your level, how mature you are from a value perspective. So let's say if we consider this as a 4 level, we'll definitely go with the majority of the sim center across the world is just a cost center. And at this stage, the simulation center is viewed as primarily as an expense. The funding is dependent on an annual budget. The services are largely free or unpriced, and the financial discussion is really happening after decisions are made. So basically, the center deliver value, but this value is very limited for the number of the people coming and very limited also to the budget that is available. The level two, where we are more like a chargeback center and we have more understanding of what we value and how much if this value cost. And basically, this is where your center start to understand the cost, understand economy, understand the value. It started to have a little effect on people. So people, when they come receive the training, they go and become a champion in the other places. And you may be able to push your value behind even the boundary of your center because you are able to understand the value and the cost of it. So you may make some saving money. In fact, sometimes even you're able to gain some money. The third level is the revenue engine or the value generator, like I want to call. And this is where simulations start to actually generate income through external programs. So the focus is actually going beyond. So he's focusing on partnership, he's focusing on some forecasting, he's really predicting what is the value he's providing, what is the capacity. And in fact, he started to affect a broader community, maybe even to a national level. And fourth level, what we're calling is strategic assets. And this is what we are actually calling today. You become a national system assets. Basically, you are fully integrated in organizational. Policies are created in the country after your testing. You become a living lab or testing lab or sandbox. And you become a very instrumental in the decision making or the laws that has been levied in the country, whatever relevant to the healthcare. And this is how I can see the simulation maturity. Many people, they think they are in level two, but actually some little, a majority in level two, because people, they think they are in level three. And I've seen very, very, very few they achieve the level four because this is not easy. And this is the goal, this is the goal, how we become a system assets where the value is understood, is defended, and in fact integrated. So let me bring you one of the examples because no one likes the fairy tales, right? I can speak, I can say rules, I can make it very theoretical, but at the end of the day, I need to convince you today, right? And this is the key, the outcome I want to get out of this presentation. All of you are convinced, all of you understand where are you living, and all of you knows, more important, how to go into become a future. So let me speak a little bit about Itqan. This is the building that I'm currently in the executive leadership for. I was one of the early founders 7 years back when Itqan opened on 2019. And until date, I'm still in the leadership for Itqan. And I don't want to share Itqan as a success story because, there's no single full perfection in any experiment in the world currently. Everyone is trying. There is a lot of trial and errors. But I wanted to present Itqan today more of a tested system. So today, when I'm speaking about Itqan, you have to know that we did every single mistake in the world that you can realize that any simulation center can do, whether it's stupid mistakes or the smart mistakes, whatever you can call. We did everything, and we fall almost in every pit. So basically, what I'm delivering today is an end result of what we are reaching after many try and error for the last 7 years. Itqan is actually is not from the beginning when we build it, we never consider Itqan as a only simulation center. We always consider Itqan as a platform, and that's why comes the big size or the large size. Itqan is one of the largest simulation center in the world with 12,000 square meter. It's a 4th floor. We have a very large auditorium, 400 seats, and we have one of the largest virtual reality lab. We have one of the largest as well wet lab with a 10 surgical position. And we have also robotic surgery training. So basically the center and is designed to become a simulation. And that's why we design Itqan not as a center or simulation center, but as a simulated hospital. So every single element in Itqan, every single device in Itqan, every single medical gas outlet in Itqan is a real. Only the not real is the mannequins. Everything else is real. So in fact, Itqan is apart from the disaster management plan of Qatar. In case of disaster management, we can be converted into a hospital that it can host 500 plus patients. So it is very large hospital. It's even not small hospital. And this is where we start, and this is where we build. Of course, with time, we know that accreditation is very important for us because recognition is always matters. And this is always our goal and our signal that the system is working. And this is our validation. And we, alhamdulillah, we tested this through a provisional, and then now we received our full accreditation on 2024. We are very close to also apply for fellowship and research, inshallah, by end of this year. And why I know that we become a system integrated or more of innovation platform because of the number of partnership we do. So basically, Itqan is not only affiliated to Hamad Medical Corporation, where we are subsidiary of, but actually we are making a big connection and partnership with all the private and public sectors, all healthcare industry players, all pharmaceutical drugs pharmacy across the region and the world, all the industry, surgical industry, all the universities in the region almost, we have a partnership with, all the association. So Itqan, after 7 years, I can say that we are part from the ecosystem, and this can be reflected easily on the dramatic acceleration of the number of people that they are coming to Itqan and learning in Itqan. So we start from 2021 in 14,000 learners until we reach last year was 45,000 learners. So this is a big number, and makes Itqan one of the very complex simulation. And why is that? When you look at for that, and I don't want to say that 45,000, the beauty about the number is the volume, because this is not the case. The evidence is actually the integration. This is a very good evidence, because when you look for the learners, where they are coming from, what is their specialty, we have Qatar Airways attendance, flight attendance, as an example, is part from this 45,000 learners. We bring them to deliver them a communication, how you can deliver bad news, because we know are very excelling on this when it's come to healthcare. Why we don't deliver it on a non-healthcare environment? And this is where we evolve, and this is the beauty about this number, that the big diversification of it. It introduced more than 65 countries. It introduces more than 15 industries, automation, oil and gas, everyone. We always deliver our value through this, because Itqan is not only a simulation center, we are innovation platform. But many people, they may say, yes, but Gulf is wealthy and you can do anything if you have the money, correct? I'm sure, 100% sure, most of you are thinking this way. So let me bring another example, because that Khan is not the only one. This is Singapore, right? And Singapore, they're using the simulation center there as a policy infrastructure. I've been visiting many sim centers there, and it's honestly the majority of sim centers there, they are partner in any, and they are part from any policy committee. So they use, in fact, simulation center as policy infrastructure, where they are actually using simulation in pandemic preparedness, and you basically can go and search a lot of literatures how they use simulation in predicting the pandemic, in the workflow, and reducing the number and reducing the risk. They use it also for ICU surge capacity modeling, and I've seen many good examples there for workflow. They use it also for workforce training aligned with national planning. So they align everything under the same center. They use it also for sandboxing. Many of the healthcare startup and tech startup, they are actually incubated in the simulation center in Singapore. So this is quite also a very good example. But you still, I think, some doubts in your mind. But Singapore, yeah, it's a good example, but it's Singapore. Singapore is a Singapore at the end of the day. It's a massive acceleration happening. So let me give you the third example, which is actually can eliminate any doubts in your mind that any center, any countries can do this, regardless what is the size of the sim center. This is very sad story, and I'm very uh, sorry for sharing this. This is basically Rwanda in 1994. This is quite disastrous period and devastated collapses in the modern history, probably the most devastated. Rwanda, they actually faced in 1994 a civil war. And like any place in our beloved continent, Africa, people, they just wake up morning and they started to fight together. And as of one of these fights, one of the most devastated collapse in the modern history, probably, 800K person were killed in 100 days. Imagine that. In fact, more than 2 million, they escaped for the neighbor countries. Most of, in fact, the Africa were bad images or people that you cannot look at. Most likely, it will taken in this period in Rwanda. But people they use it for different to express something in different country. But if you go and track it, most likely it will be from Rwanda in 1994. So the question here, if I ask anyone, what do you expect this country healthcare system looks like? This is just a very snapshot for what was Rwanda in 1994. What do you think Rwanda looks like right now? And this is what Rwanda started. Rwanda didn't really build a hospital because it was easy. How they thought, shall we build hospital? Shall we rebuild the healthcare system? Shall we build the clinics? They didn't actually go into this. They didn't waste their time on that. They in fact rebuilt the whole system. And this whole system was based on a training and innovation center. This is one of the simulation center in Kigali, and Kigali is like an innovation city, and everything started in Kigali. And one of this is I've delivered a presentation there before, one of the best simulation innovation center where you can see worldwide. And this is what they did. They created a national platform to test, train, and coordinate and scale healthcare. Every single healthcare law, it was actually initiated in this building. So they established it as a national test bed. They established a national training and capacity building hub. All medical staff from all over the country has been trained in Kigali. They are actually started also a national research and policy engine, like I said. All evidence-based programs were designated and tested before they scale it on the rest of the country. And they consider be a big partnership. All NGOs, all the donors, all the government, all ministries, all institutions, all collaboration from across the world. It actually was focused in Kigali, or Kigali is the innovation city, and this one building, one of it. They created a whole innovation cluster, and I wish I have the master plan for the Kigali Innovation City. It's quite massive. And it's quite impressive how people in such situation, they never thought about making a field hospital or clinic or care delivery settings. In fact, they focused first on how we can create innovation cluster. And this is where they make them successful. Today, when you go in Rwanda, and many people, they don't know that, but Rwanda, they call it the Switzerland of Africa. They have one of the best healthcare system nowadays. The healthcare system that 20 years ago was not exist and was apart from what you have seen. In fact, one of the quite interesting things, Rwanda, they used partnership with Zipline in 2016 to revolutionize the healthcare delivery and utilize drone to transport medical supplies and drugs to a remote area. And I've seen this doing very well during COVID, specifically when they deliver the vaccines. And this is what I think, looking at Rwanda, they did not really build a huge hospital. They did not build big programs. What they basically did, they make a system. They created an ecosystem. And this ecosystem, it helped them to test, train, and scale healthcare. So I think Rwanda is very good and exceptional model. It shows you the evidence that we are not too far. It's not too far to start from the beginning to build our system in the same way. And this is basically, I think, the framework and I want to deliver for you today is basically simulation as a strategic ecosystem. Imagine you have the simulation in the middle of your ecosystem where you can test, train, validate, and scale. And this is having a full and direct connection with educational workforce, where you can train, you can upscale, you can certify them. You can also go for innovation technology, whether for AI test bed or digital twin tools or medtech validation. You can also go for partnership and ecosystem, for industry, for academia, for startups, for partner, for ecosystem as well, where you can partner with industry, with academia, with the startups, where you can use for data decision making, like I said, for insights, for forecasting, for capacity building and planning. For policy and government, like Rwanda did, every single policy is tested in simulation center because before it's really scaled on the rest of the country. The national strategy has to be tested in simulation center. The regulation sandbox, this is must be established within the simulation center. Why is that? Because you are the most qualified hospital with no patient. You have a real hospital environment or simulated hospital environment, and you don't have patient. So what is best and safest part than this? That's why it's a very good simulation platform to become apart from the healthcare system, where you can test the clinical workflow, when you can test patient safety, when you can test care model. And this is what I'm thinking of. Simulation is a platform, it's not a department, it's not a testing room, it's not a train room. It is more than this. It's the engine that is actually can easily connect all of this and scale the whole entire system. So how actually we can build? What exactly it takes to build this? This is what the theory, the most common theory in the world, it's the 4 Bs. It's the purpose, where you can start with why. If it doesn't solve a real problem, then it doesn't matter. So your testing has to have a purpose. The people and the process, ideas that are easy, but execution always difficult. And what is why we are really reluctant in sometimes in some healthcare system, because we did not test this before, and there's many laws and regulation and policies prevent you from actually going and apply this directly on a patient. People is very crucial element. There must be people behind that they really they understand the real pain. And the platform itself, it's a very, very, very important, because many of you actually, when I'm saying platform, I'm sure 100% it comes to you as a technology, but technology is just a platform, but it's not necessarily amazingly going there. If you go for, and I did present in India before, and one of the good presenter, he's mentioning one word, they call it a jugad. And jugad basically, it means how you can innovate and test and learn from mistakes and to develop a very low tech, but it's in technology or low tech solution, but you are solving a massive, huge problem. So as an example, if you go there and in Gulf, when you go and you want to do air purification or you want to do energy saving, you do this through a solar panel, and solar panel, we know it's not an efficient way to do it, but in India, they would do it completely different, maybe through a raining water in rivers or something is really vernacular. It's coming from the environment. It's a very cheap to do and very easy to test and escalate and grow. So I wish really to end with this is, and I think this is what I really want to leave you with. The future of simulation is not really how many courses we run. It is how much system value we create, because this is what matters at the end. And the real question that we all need to ask, are we ready to rethink the role of simulation, or we will keep operating it the same way like we do at the moment? And this is for me to be a big shame, because we really underutilize the huge strategic assets behind our simulation center. And regardless, your simulation center, small or large, affiliated or not, you can have to treat it this way, so you become a strategic asset for the system that you are running for. Again, thank you for your for inviting me. This is my LinkedIn account. Please connect with me. If you have any questions, please share with me. I'm very happy to work with you to share with you our experiment and how you can actually and easily can be successfully turning your STEM center into a simulation. So thank you. Over
Thank
to
you
you,
so
Dr.
much,
Fiha.
dear Professor. Thank you so much for these insightful perspectives. This is really very important points. Today's presentation highlighted a clear journey from simulation as a cost center to simulation as a strategic asset capable of shaping healthcare systems. Thank you so much.
Thank you.
So while waiting, or we have questions, yeah? No. So while waiting for questions, I can start with mine. So, dear Professor, I have a question about your experience. What are the key conditions required for simulation to move from an educational tool to this strategic asset within healthcare systems? So, and I ask for barriers, for especially barriers is institutions.
Yes, it's not easy, of course, and like I said, it required a lot of change management strategy, right? You need to get a buy-in from your executive leadership. It took us few years to just convince the system that Itqan can be actually leveraged as a national platform or living lab or testing lab. I think it's not easy, but there is a few tips for that. First of all, you have to be very realistic for what you deliver and what you can deliver. And this is it. It pave you the road that leadership will listen to you and will give you that whatever you need for as a support. You need to show evidence and use a very small wins, right? So very small case study. You don't have to work in a big project or a big case study. I never seen a center is leveraging the value of it or any business basically based on a just big hit success. This has never happened. This is not realistic. You have to go always with a small win. One big tip also that we actually fall in this before, when we leverage a value, it comes to us because I'm a very tech savvy person. I like technology. I would like to advocate for technology. So basically, every time someone is asking me a problem, I'm always using a technology to solve. So just my mindset, it goes directly as a, some technology. Let's go use AI. Let's use agentic AI. And I guess this is not correct because I'm always saying this quote: having an old system or having a system that it's behind, uh, when you apply technology in this system and you don't redesign the system, you will end up with a very inefficient system, but very expensive at the same time. So this is quite interesting, where you need to look at exactly what is the problem you are solving, what exactly needed for it, and you just go and use whatever suits. If it's non-technology, then it's not technology. You don't have to push technology. And this is one mistake I did many years, in fact, in my career with the simulation, that I'm always push technology. But now I learn, now I'm bigger, now I'm older. I know that not necessarily we go technology. If the system is working very well, if the outcomes can be developed analog way, why not? At the end of the day, what is the purpose? If you redesign the system in a good way, then you can actually apply technology very easily and you get the right outcomes.
Yeah, I see this. Thank you so much. So we have a question from
Yeah.
our dear Dr. Ayoub Aitl. He says, if the goal is to shift from utilized,
Utilize, yes.
yeah, utilized simulation centers to creating a real system value with a focused task force, what concrete indicators do you use to demonstrate that this actually improves the healthcare system, not just training activity?
This is amazing question, Dr. Ayub. And actually, this is very smart question because one of the mistake always that if you look for any educational team we have, majority of the team, they are actually simulation operation specialists or educators, right? But the system that I'm looking for, it has a 3D printer technician, it has a vet, it has an IT technology, it has an AI engineer, it has an economist, it has a data analyst, it has a multi-speciality teams. And this is the way, how we are thinking to push simulation. Simulation, and I'm really apologize that I wish I don't offend that. Healthcare evolvement will not be achieved by clinical team. It will be achieved by tech people, by computer people, by high tech savvy people, by someone hospitality, his success in a dramatic, crazy business model ideas or whatever. And the same in simulation. Simulation will not be evolved by us people raised and they know everything about simulation. And simulation for us, it's more like a focused and simulation operation specialist or educator with some certification or literature review or it's a multi-speciality team. And this multi-speciality team, you can add as much as you can add. If there is someone from economy, from business, from finance, from tech, from IT, from AI, from manufacturing, you have to have all of these people because you together will be achieving a multi-speciality and then you will hit the value that you want to achieve.
Activate your mic, Siham. Please activate your mic, please.
Okay, I'm sorry. So we have another question. Can you share with us some golden tips that you learned from your daily simulation practice, and also what is the rule of translational simulation in all this? Mohammed Fahdi's question.
Thank you, Dr. Muhammad. It's amazing. And like I said, I'm a person that he got his experience from mistakes. I think if there is an award for someone that who did the number of mistakes, I would definitely take it without thinking. I did a massive number of mistakes. There's almost no mistakes that you have think of. I didn't do it, you know. Uh, so I don't know if I am able to give you golden tips, only one tip that is gold, because like I said, my experience, my success, if there is any, is shaped by a lot of things, a lot of mistakes. But basically, one thing I need to bring here is the purpose. And purpose is quite um, word that we all always underestimate. Let me explain the purpose by a little bit of an example. One year, 6, 7 years back, I have been involved in some digital transformation initiative, and one of the issues was basically how you can accelerate an appointment through a phone call for booking. So, because in Qatar here, it maybe take you a few weeks before you get an appointment with a doctor. If it's a dental, it can be even jump to a 6 months. So it's a bit dramatic here. So people think that, okay, the problem is that we are not able to process as much appointment in 1 hour. So how we can do that? I was part from the committee when we say, you know what, let's use AI. So instead of processing 100 call or appointment in a 1 hour, we in fact reach to make it 500 appointment in 1 hour. The thing is, ironically, I in this day I went and I was extremely happy in my bed, smiling like a baby. But next day we discovered that in fact the 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 bottleneck it's moved from the call center to the triage area. And this is where you need to stop, right? So I cannot go and implement AI on triage so I can move the pain and the big number to the next stop because basically this is not purpose. This is not the purpose. And in fact, when we look at from a purpose perspective, what we are actually aiming here, what is the problem? Where is the real problem? And there is a lot of strategy how you can reach the heart of the problem or the purpose. In fact, we found a different detail, different solution. And when we implement these solutions, become very successful, but not the first thinking. So this is very important. What is exactly the purpose? And purpose is a quite big word that you need to read about it and how you reach it. Because once you hit the purpose, you easily can find the solution. So I would say focus on the purpose, not on the technology.
Thank you so much. We have a question from Professor Mohawi. What role can national societies of healthcare simulation play in supporting the use of simulation to improve healthcare systems?
What rules again?
What role can national societies of healthcare simulation play in supporting the use of simulation to improve healthcare systems?
Yes, by not focusing a professor to only healthcare or only on training. So we need to consider the center and put policies that is allowing the center to become a sandbox, right? To become a validation. And this is not easy because at some point I would say that the normal leverage of testing facility in a SIM center, it's become an FDA validation authority at some point, or HTA office. In some areas, I've seen a lot of HTA offices or systems worldwide, they are accounting a lot on simulation center. So I would say by facilitating the policies that it's allowing the centers to do that, one of the areas that is actually delaying Itqan until moment it's international policies, international laws. Things like that, it has to be delaying us because we're part of the hospital. As an example, confidentiality and patient privacy, data privacy is sometimes delaying our progress and acceleration. Let's all remember that Europe, because they are very restricted in the patient privacy, it's extremely difficult to take an idea from the beginning through a testing, through a validation, and then to implementation. It's almost impossible right now to do this in Europe. And that's why many of these startups, many of these ideas, they are now coming to Middle East, and specifically Morocco. Morocco, they have a GITEX. One of the a big GITEX is done in the whole world is actually what's happening in Morocco. And Morocco become a center for a lot of startup, for technology, for VR, for AR. So I think the best to do for this sim center is to facilitate them and remove the hurdle from them, even though sometimes, and I don't want this to be taken a wrong way, but sometimes you need to compromise in the rules. Sometimes maybe you is accepted to compromise on the privacy, maybe to some certain level. Maybe you need to create some incentives. Because I do believe that you need to sacrifice something to reach a good evolvement, specifically when what we are actually calling for today.
Yeah, thank you. We have a question from Fatima Zahra Lesri. She asks, as a simulation instructor, I truly believe in the system value of simulation, but in context where the healthcare system is not yet prioritizing simulation, how can we effectively advocate and demonstrate its value to decision makers as an ecosystem?
100%. And this is what I think I started my presentation is with. We are we still in some countries we're still advocating for simulation, right? But at least today we are not saying shall we go with simulation or not. So I stop hearing this anymore. So I think we already evolved somehow, or some mindset has been there. Simulation prove its ability and effectiveness. But I think for me, simulation is still stagnant, and I'm always scared from stagnant, right? If you ask me what is your biggest fear, that it's come the day that I'm not learning anything new. Stagnation is the big problem. You are not moving. And I think simulation somehow we are in a stagnant level. We are developing much on the mannequins. We develop much on the task trainer. We're developing much on the teaching methods, but we are not developing on the adaptive simulation, as an example. How stimulation still in many simulation center, regardless of how it's very well equipped, it has the best tools, mannequin in the world. Still, simulation is very static. In my opinion, we need to develop this so we can show more values. And when you show more values, I guess more convenience will be perceiving the value of simulation. As of now, I'm afraid that we reach a level where hospitals, they do believe simulation is a good way to teach and train our staff. But I'm afraid that until now, because we are stagnant, people, they still think, okay, shall we build a small skills lab, simulation lab, or shall I expand the oncology suite, right? Here, this is will get me more money. Here, how much money, more patient, more less waiting area. As of now, the comparison between simulation center or simulation unit or business unit or whatever with a clinical space is not for our benefit. And I think this is what we need to change. We need to show value for what we have. We break this stagnation and we evolve to move from a static and to a more on adaptive simulation, from being a cost center to maybe having some profit and revenue, from a very no strategy to a very high strategy. And let's see how we can actually provide the hospital with the data that they can use to make an informal decision.
Thank you so much. So we have also two questions. The first one from Yunus Boucharib. Can your experience in building the Itqan simulation center be adapted and applied to establish a small simulation center in low-income countries?
We do this, in fact. So right now we are working with a lot of low-income countries, and we, in fact, start to develop some mannequins, low-income mannequins. We partnership with some countries in Pakistan, some countries in Africa. We work very closely with many people in Egypt. We work closely with other Gulf countries because not every country they have the ability to build something similar to Itqan. So our focus for the last 3-4 years, I would say, it's how we can make a low income simulation tools that it can be leveraged to a low income country. And this is something I'm really dedicating a big portion of my personal time for. Is I'm very happy to volunteer or been working free of charge consultancy to any countries in Africa, especially Africa or any really across the world where they wanted to build simulation but they don't have cost to pay for it or something. I have actually myself developed a low income model. It's not necessarily big, but it's a modular. So you can expand it, you can grow it. So please reach out for me, and then I'm very happy to share with you, and we can work together. And as I said, this will be completely free of charge.
Yeah, thank you so much. So the last one. Now we are trying to implant technology in our simulation sessions. How do you choose and how do you evaluate the impact on education and healthcare? So it's Noor Makawi's question.
It's an amazing question, Dr. Noor. You know, big part from simulation, you know all better than me, is evaluation, right? And the feedback and measuring the impact. The main problem, I think, that we have a breakage between what our observation and what is in the hospital, right? And I think all of us, we are facing this. There's always this politics. So we know how people they do in our center for training. So you train them in psychomotor skills, or you repeat this some certain skills you want to teach them, or even sometimes human factor or whatever. But we never, and we're trying our best to make it immersive, but we always losing the connection with the hospital or the hospital unit because they don't want to share ideas with us or to share the data or how this things is how this trainer is doing well or doing bad in that. So there is always a breaking connection, and I think the best assessment is when you make this connected. And this is something, by the way, we suffered in Itqan for 5-6 years, and it's only improved in the last 2 years, where we started to create offer our services for AMOC, or the medical error committees, and we started to, in fact, direct a movie or role-playing movies or scenarios to show them the right practice, how the scenario is really happening in the reality, and how we are actually improving. And when AMOC committee and people, they started to see this, they started to invite us for the patient and patient quality and safety environment committees, FMS committees. And it can become having a chair in almost every single patient safety committee in the hospital. And this is allow us and give us what is better than anything else is the direct access to the data. Because don't forget that our bread and butter is basically based on the gap assessment. And how you make a gap assessment from the data, how many errors you do. If you have a big falling for patient falling, then you have a problem you need to solve. And how I do this? By training. And you cannot train for something that you don't need. So I would say that make the connection, have a chair, fight for a chair in the patient committee, safety, patient journey, patient experience committee. You have to have a chair there because will offer you a very good, unique place to offer your service because they need you, but they don't need what exactly they need you, right? We call it a Latin need, right? You need something, but you don't know that you need it. It's like social media. Before social media, no one even thought about it, right? But when we have the social media right now, it's become a big demand, big need. And this is what we call Latin need, the need that you don't know that you need it.
Okay, thank you so much. Thank you so much, Mr. Metwally. As we come to the end of this session, I would like to sincerely thank you for this enriching and thought-provoking presentation. Today, we were invited to rethink simulation not only as a method, but as a mindset that encourages innovation and reflection and continuous improvement in healthcare. I would also like to thank all participants for your engagement and valuable contributions. We hope this webinar has inspired you to explore new ways of integrating simulation into your practice, not only as educators or practitioners, but as agents of change. Thank you all, and we look forward to seeing you in our future Morocco Sim events. Have a wonderful evening.
Thank you. And please connect with me on LinkedIn or my email. And I'm very happy to answer any question that I didn't answer today. Thank you all.
Thank you, Amr. Thank you, Sihan,
Thank you,
for
Professor.
the amazing webinar. And Amr, you will be able to show that simulation is not just for training room, but it's a very powerful tool to improve healthcare system as well as transactional simulation. شكرا
Thank you.
جزيلا عمرو، بارك الله فيك، جزاك الله عنا خير
Thank you,
الجزاء.
Professor. Thank you.
I'm more than happy to announce the upcoming webinar. It will be leading on May 13th. It will be led in French. As you know, Morocco seem try to run webinars in modern language, Arabic, English, and French. The next one will be in French, and it will be ensured by the Canadian team, and they will be discussing about the how to manage medical simulation centers, how to make medical simulation centers powerful into healthcare system. And the webinar of June will be back to English with an exceptional webinar with the head of SSH, and this one will be chaired by Dr. Mohammed Darwish. سلام الله عليكم، شكرا جزيلا، إلى الملتقى. السلام عليكم.
Have a nice evening.
Yeah.